Title: Global Surge. HMPV cases rise across the world. What you need to know. Hey, everyone. Welcome back to the channel. If you're new here, make sure to hit that subscribe button so you don't miss out on the latest updates. Today, we're talking about something that's affecting millions of people worldwide: the rising cases of HMPV. Let's dive into which countries are facing the brunt of this new health crisis, how it's spreading, and what's being done to manage it. Stay tuned. Hey, everyone. If you've been following the news, you probably know that a new virus called HMPV, which stands for human metapneumovirus, is making headlines globally. It's spreading fast, and countries everywhere are feeling the effects. In this video, we'll break down the rise in HMPV cases, which countries are most affected, and what's being done to stop the spread. A map showing the spread of HMPV globally with red dots indicating case hotspots. Let's start with a quick overview. HMPV is a respiratory virus that causes symptoms similar to the flu, fever, cough, sore throat, and difficulty breathing. While it mostly affects children, elderly adults, and people with weakened immune systems, the virus is spreading faster than we thought, and health systems worldwide are being pushed to their limits. Now, let's look at the countries that are currently facing the highest number of cases. 1. United States. First up, the United States. The US has seen a rapid increase in HMPV cases in the past few months, particularly in states like California, Texas, and New York. Hospitals are dealing with a surge in emergency room visits, and many are at full capacity. There's been a particular concern in children's hospitals, as HMPV affects the younger population quite severely. Dr. Emily Parker, interview clip: "We're seeing more severe cases in children, and in some cases, they need to be put on ventilators. This has been an incredibly stressful time for pediatric healthcare providers, and it's not just the children. Older adults and those with underlying health conditions are also at high risk." Public health officials are urging everyone to take precautions like wearing masks, washing hands, and staying home when sick. 2. Europe, UK and France. Next, in Europe, countries like the UK and France are also grappling with rising HMPV cases. Both nations are reporting sharp increases in hospitalizations, particularly during colder months when respiratory infections tend to spike. Images of hospital queues and crowded medical facilities in the UK and France. In the UK, the government has issued public health advisories, and French hospitals are warning about critical shortages in staff due to the increasing workload. European health experts are scrambling to assess the scale of the outbreak and make sure resources are allocated properly. 3. South America, Brazil and Argentina. In South America, the situation is similarly dire. Brazil and Argentina are both experiencing an uptick in HMPV infections, especially in urban areas where close contact and dense populations make it easier for the virus to spread. Local hospitals are reporting high occupancy rates, and authorities are urging citizens to follow safety measures more strictly. Brazil, already battling healthcare pressures due to past health crises, is facing yet another major hurdle with HMPV. And in Argentina, officials have asked the public to refrain from large gatherings, especially in the colder months when respiratory viruses thrive. 4. Asia, India and Southeast Asia. Over in Asia, countries like India, Indonesia, and Thailand are reporting an increase in HMPV cases as well. Many of these countries were already struggling with the aftermath of previous health challenges, and now, with HMPV spreading rapidly, the healthcare system is at risk of being overwhelmed. India has been hit particularly hard, with higher than expected case numbers showing up in both urban and rural areas. Public health experts are working around the clock to curb the spread, but they face the challenge of limited resources in some regions. 5. Africa, Egypt and South Africa. Meanwhile, in Africa, countries like Egypt and South Africa are also reporting a rise in HMPV cases. Healthcare systems here are often under-resourced, and this new surge is testing their ability to cope with multiple viral threats simultaneously. South Africa is dealing with a double threat, with HMPV adding to the already widespread concerns of other respiratory diseases. Officials are urging international collaboration to provide better resources to countries with fewer medical supplies. 6. The global response and what's being done. So, what's being done about it? The World Health Organization, WHO, is calling for global cooperation to contain the virus, with a special focus on providing aid to countries with weaker healthcare infrastructures. Countries are ramping up vaccine development, improving testing protocols, and advising the public to continue practicing social distancing, mask wearing, and good hygiene to slow the spread. Final thoughts. What you can do to stay safe. While things may seem challenging right now, it's important to stay informed and prepared. Follow the health guidelines from your local authorities, get vaccinated if possible, and keep yourself and your loved ones protected. We'll keep you updated as the situation evolves, so don't forget to like, share, and subscribe for more updates. Leave a comment below if you have any questions or if you're experiencing the situation in your country. Stay safe, stay healthy, and as always, take care of each other.